Today we are going to discuss about pharmaceutical care. So pharmaceutical care is defined as the care that a given patient requires and receives when assures safe and rational drug use. The pharmaceutical care as the responsible profession of drug therapy for the purpose of achieving definite outcomes that improve the patient's quality of life. This definition was considered to be more realistic and goal-oriented, and particularly for chronic diseases such as diabetes, where the maintenance of quality of life is an important consideration. The practice of pharmaceutical care is a new concept in contrast to the present practices of the pharmacist. In routine practice, pharmacists dispense the medicines against a prescription. But in pharmaceutical care practice, pharmacist analyzes the prescription, identifies the drug-related problems, and resolves the same in consultation with the prescriber and the patient. So, the goal of pharmacist in pharmaceutical care is to meet the patient's need for appropriate, effective, safe, and convenient drug therapy in terms of desired therapeutic outcomes and improved health-related quality of life. Documentation and monitoring of the care is also an important step in pharmaceutical care process. So this is defined as a specific activities and services through which individual pharmacists cooperate with a patient and other healthcare providers in designing, implementing and monitoring a therapeutic plan for a patient. Or it is defined as the responsible provision of drug therapy for the purpose of achieving definite therapeutic outcomes that improve the patient's quality of life. In pharmaceutical care practices, drug-related problems are analyzed during the treatment and suitable solutions are worked out to minimize or prevent them. And coming to the main objectives of the pharmaceutical care, the first one is the cure of the disease, arresting or slowing of a disease process, preventing a disease or symptom, elimination or reduction of patient symptoms. So these are the main objectives to perform the pharmaceutical care services in a hospital. And the pharmaceutical care services will be patient oriented. Both acute and chronic problems will be addressed. Stress on prevention of drug related problems, and it will the documented system on patient's record and need and care, offering continuous care in a systematic way, taking help of other healthcare providers in integrating the care provided, highly accountable and responsible emphasis on optimizing patient health related quality of life, emphasis on patient health education and health promotion. So, the basic steps in a pharmaceutical care are the collection of patient data, identifying potential and actual drug-related problems, resolving actual drug-related problem and preventing potential drug-related problems, individualizing drug regimens, establishing outcome goals through a good therapeutic plan, monitoring outcomes, evaluating treatment alternatives by monitoring and modifying therapeutic plan. And it doesn't imply that the pharmacist is longer responsible for dispensing function, rather redesigning of professional workflow with the assignment of technical functions to technical personnel under the direct supervision and responsibility of the pharmacist. The patient communication in clinical practices is defined as the dialogue between the pharmacist and the patient for the purpose of obtaining the information needed to access the patient's status. So, to provide required support and education on drug therapy, diet or lifestyle modifications in order to achieve the desired therapeutic outcomes. So, in order to have successful patient interaction, the pharmacist should possess the qualities like active listening, body language and voice modulations. So, important steps involved in the communication process are opening the interview, setting the stage for good communication, obtain complete information, control the flow of information, and closing of the interview, which we have already discussed in the patient counseling chapter. The steps what the pharmacist had to do for a better patient counseling outcome, the same they have to follow in the pharmaceutical care interview also. So, the skills required for good pharmaceutical care practices are the good communication skills and sound knowledge on therapies and prescription interpretation skills and maintenance of a record. So, the pharmaceutical care process is a systematic approach to the delivery of pharmaceutical care involves the following steps. The steps involved are assess the patient's drug therapy needs and identify actual and potential drug-related problems. Develop a care plan to resolve and prevent the drug-related problems. Implement the care plan and evaluate and review the care plan. So, in the first step, we have to collect the basic details of the patient. So, what all details we have to collect are the demographics, the age, sex, race, height, weight ratio of the patient, the current problems, the signs and symptoms, the diagnosis of the patient, the medical history, current medication, allergies and intolerance, pregnancy and lactation status, the habitats, habitats of the patient, like whether he is a smoker or he's a alcoholic or something like that. Economic status of the patient, so that we can choose the correct therapy the patient, so that the patient can follow without any defense, without any changes, or the patient can clearly buy the medicines with the economic status what he or she is having, relevant laboratory data. So this is an important step in the pharmaceutical care process. In this step, the pharmacist will be able to identify the disease-related and the drug therapy-related problems in consultation with the patient and the patient healthcare provider. So, in addition, the pharmacist may also identify opportunities for health promotion and illness prevention. The pharmacist reviews the patient risk factors like demographic characters such as age, gender and weight, relevant medical history and current active medical problem, impaired of organs responsible for drug metabolism and elimination such as liver and kidney, previous history of any allergies to any medicines, or any cognitive factors such as any mobility, dexterity and comprehension. This information is generally available in patient medical records or patient case sheets. An interview with patient also, or patient caregivers also will help to know about this informations, and the patient pharmacist can collect information on social and environmental factors such as home environmental, social drug use and family support, patients' health beliefs including the perception of drug therapy and anticipated benefits of the therapy. Pharmacists should assess the response to current drug therapy, manifestation of allergies if any, or complexity of the regimen and use of devices like inhalers, rotahalers or any insulin pens or such anything like that. The pharmacist must collect or generate subjective and objective information regarding the patient's general health and activity status, medical history, medication history, social history, diet, exercise, and study history of present illness and economic status. Sources of information may include but not necessary to be limited to patient medical charts and records. The pharmacist conducted health or physical assessment, the patient's family or caretaker, insurer, and other healthcare providers like his doctors, nurse, and his regular pharmacist to whom he goes. So, since all this information will ultimately form the basis of the decision regarding the development and subsequent modifications of the drug therapy plan, it must be timely, accurate, and complete. The information must be organized and recorded to assure that it is readily retrievable and updated from time to time. This information of the patient must be maintained in a confidential manner. So, after the data has collected, the data collected can be used to identify actual or potential drug related problems, and these problems may be related to the patient's current drug therapy, drug administration, drug complaints, drug toxicity, adverse drug reactions, and failure to achieve desired outcomes by the treatment. Ultimately, the drug-related problems can result in increased morbidity or mortality. Some of the prominent drug-related problems are: the patient has a medication condition that requires the initiation of a new or additional drug, for which a wrong drug is administered, for which too little of the right drug is given, for which too much of the right drug is given, which may provoke ADR or drug toxicity resulting from not taking drug appropriately, like before food, after food, 2 hours after food, or on empty stomach, if the patient is not following the instructions correctly. ADR from the drug that the patient is currently taking, resulting from drug to drug or drug to food interactions, non-complaints for non-valid reason, self-medication for non-medically valid reasons. And the potential reasons are by which the patient may be at the risk to develop a new medical problem created due to additional drug therapy being indicated, and taking unnecessary medications, wrong drug being prescribed, too much or too little of the current drug, occurrence of ADR, non-complaints of the prescribed medications also can cause these drug-related problems. The pharmacotherapy involves both benefits and risks, as we all know. The risks include the side effects and adverse effects of the drug while using them to treat the disease. Many researchers observe that the adverse effects of the drugs may lead to hospitalization, affect the desired therapeutic outcomes, patient quality of life, and increase the healthcare expenditure also. The negative impact of the drug therapy may result in morbidity and mortality. In pharmaceutical care practices, drug-related problems are analyzed during the treatment and suitable solutions are worked out to minimize or prevent them. Drug-related problems is defined as an undesirable event that a patient experiences that involves or is suspected to involve in drug therapy and that actually or potentially interferes with the desired patient outcome. So, some of the drug therapy related problems in practice are: so, the health is defined as a physical, mental, and social well being of an individual. Medicines are used to treat various disorders. Medicines, if appropriately used, will give relief to patients and can cause harm to the individual's health if inappropriately used, and increases the therapy related expenditures to patients and to the government. So, worldwide, the pharmacists are offering professional services in community, hospital, and clinical setting to meet the patient's pharmaceutical requirements. By virtue of their knowledge in this area of therapeutics and clinical pharmacy, pharmacists are able to identify drug-related problems and provide suitable solutions to the patients, and as counselors, educate the patients about safe usage of their medicines, appropriate diet, and lifestyle changes to maximize the therapeutic benefit. The pharmaceutical public health has been defined as the application of the pharmaceutical knowledge, skills, and resources to prevent diseases and prolong the life through promoting, protecting, and improving the health of the society in an organized way. So, pharmaceutical public health addresses the health-related issues to social level, where the pharmaceutical care addresses the health-related issues as individual level. So, some of the drug-related problems in practice are indication without drug, drug without indication, improper drug selection, inappropriate dosage, adverse drug reactions, drug-drug interaction, drug-food interactions, failure to receive drugs, non-adherence to medications. So, coming to the description of the drug-related problems, the first one what we are going to discuss is the indication without drug. So, whenever a patient is suffering from an illness and develops a new or worsening the current situation requires additional drug therapy. So, for example, a patient suffering from rheumatoid arthritis using NSAIDs for symptom relief may present symptoms of gastritis. So, this situation requires an additional drug such as H2 receptor blocker, ranitidine, or proton pump inhibitor, omeprazole, to control the gastritis symptoms. So, in order to treat a chronic condition such as hypertension, if the combination therapy or of different mechanisms is required, such as use of calcium channel blocker and beta blocker in achieving goal blood pressure. This is a second example. So, in the management of tuberculosis, along with the drug therapy, first line drug therapy of isoniazid, the patient may be received or advised to take pyridoxine to prevent the peripheral neuropathy caused by isoniazid. So these are the examples for indication without drugs. So the pharmacist or the prescriber in the pharmaceutical care sector, the pharmacist has to take care of the indications which are present for the patients without drug is prescribed. For that also the point has to be given. So the next one is the drug without indication. During the course of treatment, the prescribers are often enthusiastic to control the signs and symptoms of the disease. So in this process of that, the patient may expose to potential drugs that do not have any medical indication. A drug without suitable indication will pose unnecessary toxicity or side effect to the patient and also forces the patient or payer for additional cost. For example, if the patient is diagnosed as asthmatic and advised to take salbutamol inhaler 200 and budesonide, the patient is also prescribed tablet pantoprazole 40 milligram once daily for 15 days. If the patient has not complained of any symptoms of gastritis or peptic ulcer disease, so use of pantoprazole can be considered as a drug without indication here. So this is not a proper therapy. A drug without indication can affect both the patient's economic status and the good health status. So that's the second example for a drug related or therapy related problem. And the third one is the improper drug selection. So, if a patient is not receiving intended positive outcomes of a prescribed therapy, this may be due to wrong selection of the drug. So, unfortunately, the patient is exposed to this kind of situations frequently. It is also essential to have a balance between the benefits and side effects of the medicines for desired quality and comfort of the patient's life. So, any given drug regimen can be considered as wrong for a specific patient at a given time if the dosage form is inappropriate. For example, if a 25-year-old patient with mild angina is receiving nitroglycerin patches to be applied on daily basis, or another example or another condition is the contraindication for the present what we have for the drug what we have given. For example, a pregnant woman receiving isoteritonine 20 milligram twice daily for 2 weeks for acne vulgaris. So this is an example for a contraindication. Pregnant women always receive drugs based upon the pregnancy category of the drugs only. And the next condition, if the patient condition is refractory to the drug, so the patient will not, or the patient body will not, or the patient body is resistant to the drug or will not answer to the drug. So in that case, we can explain with an example. If the child with otitis media is receiving an amoxicillin 125 milligram thrice daily with a previous history of unsuccessful exposure to the same drug. So what's the outcome? What will be the outcome of this therapy? We are taking more drugs for the therapy. The patient has to undergo multiple therapies. The economic status of the patient will be undergoing. This is what happening in this condition in the wrong drug selection. And one of the next example, if the drug is not indicated for the patient condition or more effective drug therapy is already available for the same condition of the patient. Like for example, a patient suffering from chronic asthma is being treated for hypertension with propranolol. So the drug for hypertension is being considered as wrong drug because it can possess bronchoconstrictive property. So this is another example for the drug related problem. And the next one is the inappropriate doses selection. The best diagnostic techniques, assessments and skills to care for the patients will become nullified if the patient are receiving inappropriate doses or potentially effective medication. So this may lead to serious or expensive healthcare problems. Following are the examples of the inappropriate drug dosage selections. First one is the wrong dose. A 2-year-old child receiving amoxicillin 40 milligram orally for her first episode of otitis media. And another example for wrong dose is the paracetamol normal dose is 50 milligram per kilogram per dose, and the maximum dose per day is 60 milligram per kilogram per day. If we are giving an overdose about this is wrong dose selection. And the next type of inappropriate dosage selection is the inappropriate frequency. If a 45-year-old man with peptic ulcer is receiving omeprazole 20 milligram thrice daily, so or a pantoprazole 40 milligram twice daily, another than in other case the patient is not having any peptic ulcer or gastritis or anything related like that, the patient is advised to have it's only omeprazole for twice daily and pantoprazole for once daily only. So the duration inappropriate. A 15-year-old boy receiving amoxicillin to 50 milligram TID for respiratory tract infection for 3 days. So the amoxicillin treatment should be given for 5 days for an effective treatment. So, and the next one is the incorrect administration. The doctor has prescribed amoxicillin 125 milligram per 5 ml TID for respiratory tract infection for a 4-year-old boy. The medicine bottle comes with a measuring cup, but the mother uses a plastic baby spoon to measure the dose. So this is also an best example for inappropriate dosage. And coming to the next drug-related problem is the adverse drug reactions. The objective of good therapy is to ensure the patient receives the most effective and safe medication. When it comes to the safety, the most commonly used word is adverse drug reactions. Adverse drug reactions are considered as one of the drug therapy problems that can prevent a patient receiving complete benefit of therapy. So, within the practice of the pharmaceutical care, adverse drug reactions are defined as undesirable negative effects caused by the medications that are not predictable based on the dose. So, the plasma concentration and pharmacology of the drug following are the common causes for the patients to experience adverse drug reaction. In case if the patient receives a drug product which is unsafe, or patient having a non-allergy to the prescribed medicines, incorrect administration, potential drug interactions leading to an adverse drug reaction. For example, a 15-year-old patient receiving ofloxacin 200 milligram BID and paracetamol 500 milligram TID for fever, and after 2 days of treatment, the patient experienced bleeding from gums, hematuria, and he was immediately taken to the hospital. The doctor has ordered for blood picture. The lab value suggested that the platelet count was 15,000. So, literature review reveals that the multiple doses of ofloxacin can cause thrombocytopenia purpura. So, this reaction is probably ofloxacin-induced thrombocytopenic purpura. So, coming to the next drug-related problem is the drug-drug and drug-food interactions. So, the drug-drug and drug-food interactions are considered as one of the important drug therapy-related problem. Patient care involves use of multiple medicines to achieve desired therapeutic goals. In the process of that, the patient may take 2 or more medicines at a time. When 2 or more medicines are taken at the time, the patient may experience either a good benefit or no benefit or severe side effects. So, this situation is resulted due to either pharmacokinetic or pharmacodynamic reason. The pharmacist may identify the potential for drug interactions and frame suitable strategies to minimize them. For example, if a diabetic patient was asked to take ciprofloxacin for cellulitis, if the patient takes ciprofloxacin as advised by the doctor and also uses antacid which he was taking for his gastritis, may lead to potential drug interactions between antacids and ciprofloxacin which will leading to the therapeutic failure. So the mechanism involved in this case is ciprofloxacin require acidic environment in the stomach for its absorption. However, concomitant use of antacids neutralize the stomach pH and the absorption of ciprofloxacin will be hampered. So, to prevent this situation, the pharmacist should advise the patient to take the antacids after 2 hours of ciprofloxacin. So, however, till now we are discussed about some of the examples of the drug-related problems. One is the new or additional drug required. That is the patient with indication but without drug. The patient has a new medical condition requiring treatment, a chronic condition requiring continuation of therapy, requires additional therapy to achieve the desired treatment outcomes, or is at a risk of developing a new condition preventable by prophylaxis or pre-medication. And the second one is the wrong drug selection. The drug chosen is ineffective and contraindicated. Cheaper, equally effective alternatives. When a cheaper or equally effective and alternative drugs are available, also the patient is given with a wrong drug or dosage selection. The patient has known allergies to the drug, or combination therapy is being used when a single agent can be sufficient, and too little of the right drug has given for the patient. If the drug dosage is too low, the measured serum levels were subtherapeutic, and the duration of the therapy was too short or inappropriate therapeutic substitution. And some of the other drug related problems which are not mentioned here are the failure to receive the drug and the non-adherence to the medications. So if you are explaining that, coming to the failure to receive drug, this situation is commonly seen in the hospital setup. Despite the prescriber has ordered the medication for the patient, the duty nurse may fail to administer the drug. This may happen due to heavy workload. So altered concentration changes of the nurses during the shift and forgetfulness can cause this. So in community setting, the patient may not purchase the medicine due to high cost of the therapy or forgetfulness. Or if the patient do not take the intended medicines at the prescribed timing, the patient may not get the desired therapeutic benefits. So next, coming to the non-adherence to the medications, the complaints represents behavior of the patient. So any amount of care taken for the diagnosis and giving a prescription will become futile if the patient does not take the medicines as per the instructions given by the prescription or the prescriber. So non-complaints will lead to the therapeutic failure, reoccurrence of the symptoms or aggravation of the clinical condition, and increased cost of the therapy. So cost of therapy, non-availability of the medicine, polypharmacy, adverse effects, and forgetfulness are the common causes of identified for non-complaints. So the pharmacist can play a vital role in improving the patient's medication adherence behavior. Pharmacists can use suitable aids such as drug dosing calendars, use of large visible print on labels, telephone reminders, and auxiliary directions to explain the appropriate use of the medicines to improve the medical adherence behavior in patients. And coming to the for all identifying these drug related problems and covering the second step of the pharmaceutical care, of course the pharmacist has to have a good communication skill. Of course, the pharmacist has to study well about the patient structure, patient conditions, as what we have discussed in the first step. So good communication skills are very well needed for the this pharmacist for identifying all this and to discuss with the patient. So therapeutics is defined as the application of medication knowledge such as mechanism of action, fate of the drug in the body, dose and dosing schedules, contraindications and drug interactions in the management of disease. Sound therapeutic knowledge will help the pharmacist to identify the potential drug related problems and find suitable strategies to resolve them. A prescription is defined as the medication order given by the clinician to treat the patient. So, in comorbid conditions, the patients may have to take 2 or more medicines before dispensing the medicines. If the prescription is reviewed by the pharmacist, we will be able to identify the potential drug-related problems, and we'll have the opportunity to discuss the same with the prescriber and the patients to resolve them. So, documentation of the service provided to the patients will act as a proof of the pharmaceutical care practice. With the help of softwares available in the market, the pharmacist can develop patient medication records and can use them to update the patient or medication related information as well as. This ensures the quality of practice and also improves the patient's health. So, as what we have already discussed, we have completed the first two steps of in the pharmaceutical care process: assess the patient's drug therapy needs and identify actual and potential drug-related problems. And the next step, develop a care plan to resolve and prevent the drug-related problems. So, now we are moving to the third step of the pharmaceutical care, which one is the establishing outcome goals. So, drug therapy can produce a range of positive clinical outcomes such as cure of disease, elimination or reduction of the patient's symptoms, arresting or slowing of disease process, and prevention of a disease or its symptoms for future. So, it may also result in negative outcomes resulting in disease morbidity and even in extreme cases mortality. So clearly the potential clinical outcomes are related to the disease being treated and the efficacy of the available drug treatments. So it is also important to take into account patient's expectation of the treatment and the patient's suitability for the treatment and above all. So his resources to meet the cost of the treatment. A patient may have a curable disease but his other concomitant ailments may prevent the most effective treatment to be given. So, therefore, it is necessary to educate the patient for the potential outcomes of the drug therapy, positive or negative, so that he can make an informed decision. The economic consideration, especially when patients' points of view are also important and pertinent to the provision of pharmaceutical care. Questions like what is the cost effectiveness or cost benefit of one therapy versus that of another? How can other cost be controlled or actually brought down by appropriate therapy? Example, cost of hospital stay is a major economic consideration for most of the patients. How can the length of the stay in a hospital be shortened, which will result in substantial monetary savings for the patient? So it is now well established through several clinical experience and studies that appropriate drug therapy is related to hours in the hospital, means length of stay in the hospital. So in the second step, we will develop a care plan. The care plan is an agreement between the pharmacist and the patient regarding the medication use management. During the care plan, the pharmacist in consultation with patient understands the drug therapy needs, identify potential and actual drug related problems, develop strategies to resolve them, and establish patient specific goals in achieving the desired therapeutic outcomes. So for example, if the patient has developed an unpleasant effect after the use of certain medicines, the care plan includes listening the patient problems and the drug involved in causing the problems and assessing the association between the drug and the patient problems. So after identifying all the drug related problems or the patient basic demographics and allergic history, medical history, medication history, family history, everything, the pharmacist will try to find the drug related problems, if any, in the patient drug chart, and after identifying the drug related problems, he will individualize a therapy for this particular patients and develop a care plan. So after that, in the second step itself, the pharmacist will implement the care plan to the patient, so whether for knowing whether the patient condition is improving. So after deciding the care plan, the pharmacist will make suitable and acceptable interventions in consultation with both prescriber and the patient. The pharmacist will document all the interventions made regarding the therapy in patient's care notes for prescribers' perusal and acceptance. So that's all about the third step. And coming to the fourth step, evaluating treatment alternatives by monitoring and modifying the therapeutic plan. So this is a follow-up stage in the care plan. Follow-up consists of scheduled interactions with the patients by the pharmacist to assess the outcomes of the proposed interventions, such as the recommended care plan has produced a desired outcome or not and resulted any other new problem. So while evaluating the treatment alternatives or therapeutic options, the following factors have to be considered, such as the efficacy and safety, availability and cost of treatment, and suitability of the treatment to the patient. Efficacy and safety must be considered when evaluating the risk-benefit ratio of a particular treatment. This risk-benefit ratio will depend upon many factors. Some of the factors mentioned are mentioned below. So the seriousness of the disease or condition, consequence if not treating the disease, the efficacy of the disease, the adverse drug reactions associated with the drug therapy, efficacy of alternative drug or non-drug therapy, and the side effects of the alternative drug. And coming to the fifth step, after deciding everything or after taking a look upon the each and everything what we have discussed already, the individualized drug regimens will be designed. So, where more than one therapeutic alternative exists, the patient therapy should be tailored by taking into consideration the following factors. The patient factors are diagnosis, what is the treatment goal, what is the psychological and pathological factors, the medication history, past medicines received, the contraindications, allergies and adverse effects, patient's complaints, the patient cooperation and the convenience. So this all we have to discuss. That's all coming under the patient factor. And the drug factors are the efficacy of the drug, adverse effects, the ability to monitor for efficacy and avoid ADR, the drug-drug interaction, pharmacokinetics and pharmacodynamics of the drugs, dosage form, route and method of administration, cost of the patient, cost to the patients, or whether it is affordable or no, government or insurance company payments, presentation of bills in their formats, special consideration. So this all are coming under, or this all matters should be taken care when we are developing a care plan or individualizing a therapy for a individual patient. And after individualizing the therapy, we are monitoring the outcomes from which the patient is get from the individualized therapy. The pharmacist regularly review the subjective and objective monitoring parameters to ensure that satisfactory progress is being made towards achieving the desired outcome according to the therapeutic plan. The pharmacist and the patient determine if the original plan should continue or it needs modifications. If modifications are needed, the pharmacist works with the patient and his other healthcare providers to modify the plan and implement the revised plan. The pharmacist reviews ongoing progress in achieving desired outcomes with the patient and provide the report to the patient's other healthcare providers, that is doctors. The pharmacist provides a mechanism for the follow-up with the patient. He then notifies the patient's other healthcare providers about the level of adherence to the plan by the patient. The pharmacist regularly updates the patient's medical and the pharmacy records with information concerning patient progress. So, that's what about the monitoring of the individualized care what we have provided to the patients. So the pharmacist practice functions provide pharmaceutical care, establish pharmacist patient relationship. He will collect data, interpret the data, identify the drug related problems, determine priority of drug related problem, determine desired outcome. So both clinical and therapeutic outcome will be desired. So develop therapeutic plan, develop monitoring plan, implement and follow up the pharmaceutical care plan. So this is the brief explanation of the pharmaceutical care. So these are the steps through which the patient is undergoing a pharmaceutical care, or these are the steps to which a pharmacist should provide the proper pharmaceutical care. So the pharmaceutical care services include all the services such as drug dispensing, drug information, patient counseling, drug therapy monitoring and health screening services. All the activities can be done in a spacious community pharmacy managed by a trained pharmacist practicing community pharmacy. So here we have also facing some of the barriers to implement this pharmaceutical care. So the pharmaceutical care service is an outcome oriented and provider specific practice in the interest of patient care. So however, due to various reasons, the community pharmacists may not show interest to provide pharmaceutical care services. These reasons are considered as some of the barriers. The barriers may be pharmacist based or pharmacy specific. The pharmacist-based barriers are the lack of time, increased workload, lack of knowledge and training to provide the services, lack of assertiveness, poor communication skills, non-legalization of the services, and lack of remuneration, or an assumption that the patient care is just the doctor's responsibilities. So these are the barriers. These are the same barriers what we have discussed on the patient counseling portion also. So same are coming under the barriers of pharmaceutical care also. So coming to the pharmacy-based barriers are the inadequate space and facilities, inadequate aids for providing pharmaceutical care to the patients. So, pharmaceutical care is a patient-oriented approach in identifying, resolving, and preventing drug therapy problems. The entire process includes assessing patients' drug therapy needs, developing a care plan, implementing the same, and reviewing the care plan to assess the achievement of the pharmaceutical care objectives, and if necessary, review and revise the care plan. In order to provide efficient pharmaceutical care, the provider should have sound therapeutic knowledge, effective communication skills, prescription interpretation skills, and effective document. And this pharmaceutical care is responsible provision of drug therapy in order to achieve the desired therapeutic outcomes and improve patient quality of life. Good communication skills, sound knowledge in therapeutics, prescription interpretation skills are the essential quality for a pharmacist to provide effective pharmaceutical care. A systematic approach to provide pharmaceutical care is to assess the patient's drug therapy requirement, analyze drug related problems, and resolve them in consultation with the prescriber and the patient. And lack of knowledge, training, and non legalization of the services, inadequate facilities are the identified barriers for providing the proper pharmaceutical care. So, as of now, as what we have discussed till now, we are just consolidating the pharmaceutical care chapter. So, the pharmaceutical care is the care that a given patient requires and receives, which assures safe and rational drug use. Then we have discussed about who all needs the pharmaceutical care and what are the steps coming under, or what are the steps we have to we have to follow to provide a better pharmaceutical care, and what are the skills a pharmacist should have to provide effective pharmaceutical care service, and what are the drug related problems that a patient has to face when he's undergoing a drug therapy. So health is defined as a physical, mental, and social well-being of an individual. So medicines are used to treat various disorders. Medicines, if appropriately used, will give relief to the patients and cause harm to the individual's health if inappropriately used, and vice versa. So increase the therapy-related expenditures to the patient and to the government also. So if we are using inappropriate drugs, this will of course not only affect the health of the patient but also the economic status of the patient. Okay, and indeed it will affect the society expenditure also. So worldwide pharmacists are offering professional services in community, hospital, and clinical setting to meet the patient's pharmaceutical requirements. So by virtue of their knowledge in the area of the therapeutics and the clinical pharmacy, the pharmacists are able to identify drug related problems and provide suitable solutions to the patients, and as counselors educate the patients about safe usage of their medicines. So appropriate diet and lifestyle changes to maximize the therapeutic benefits. So pharmaceutical public health has been defined as the application of the pharmaceutical knowledge, skills, and resources to prevent diseases and prolong the life through promoting, protecting, and improving the health of the society in an organized way. Pharmaceutical public health addresses the health related issues at the society level, where the pharmaceutical care addresses the health related issues at individual level. So that's all about the pharmaceutical care chapter. So till now we have discussed about the definition, the steps to be followed to provide a proper pharmaceutical care. And now we are going to discuss about the pharmaceutical care in India. What's the situation of the pharmaceutical care sector in India? So pharmaceutical care in India is shifted from product oriented dispensing to patient centered care, aiming to improve the quality of life by addressing drug related problems. While growing due to pharmacy programs and chronic disease management needs, it faces challenges like lack of formal training and traditional dispenser only roles. And coming to the key aspects of pharmaceutical care in India, the evolution of role. The role is evolving from just dispensing to providing counseling, managing chronic conditions, and promoting rational medicine use. And we are also engaged with the PharmD programs, and we have rolled out the PharmD programs in Indian universities. The introduction of PharmD or Doctor of Pharmacy in India has created a new cadre of pharmacists trained in clinical settings, improving the prospectus of pharmaceutical care. The community pharmacy shift. The pharmacists are increasingly playing a role in smoking cessation, health education, and patient counseling, though limited by public perception and lack of infrastructure. The challenges faced by the aspects of pharmaceutical care in India are the key barriers include a lack of formalized clinical training for many pharmacists, low adoption of document systems, and resistance from some healthcare professionals to expand the pharmacist clinical role. And the opportunities are the rise in chronic non communicable disease means there is a high demand for pharmacy based chronic disease management, which pharmacists are well suited to provide. And the current initiatives are Indian Pharmaceutical Association provides good pharmacy practice guidelines, Clinical Pharmacy Council working to recognize and support specialized clinical pharmacists in India. The need for pharmaceutical care is urgent in India due to increasing medication errors and antimicrobial resistance. In recent years, rapidly changing disease profile pattern, shortage and uneven utilization of healthcare professionals contributed massive burden on the Indian healthcare system, which resulted in varying, fragmented, inconsistent healthcare delivery to the patients and poor patient management. Patients often face and experience many challenges like lack of accessibility, poor patient healthcare provider relationships, and inadequate quality of care, resulting in unnecessary economic burden in managing their health condition. Thus, Indian healthcare reform is essential. Over the last 2 decades, the country's inpatient and outpatient load has risen dramatically. The nation's health workforce totals around 5.7 million people. Although there is a general shortage of healthcare professionals due to their uneven distribution among states. As a result, many healthcare practitioners across the country engaged in dual practice to handle the patient load, raising worries about prescription errors and drug related issues. Aging populations bring new challenges such as multimorbidity, polypharmacy, and the engagement of several healthcare professionals which complicate outpatient management. For example, it is obvious that polypharmacy contributes to the notable incidence of medication errors, adverse drug events, and other medication safety issues among patients. The challenges by the medication errors. The medication errors are a major public health concern, compromising patient safety, undermining trust in the healthcare system, raising expenses, and lowering quality of life. In India, roughly 5.2 million medication errors occur each year, with an incident rate of 1.5 medication errors per 100 prescriptions. Challenges of adverse events in treatment. Adverse events in medical treatment are a major global issue that are frequently caused by medical mismanagement rather than patients' underlying diseases. Unfortunately, this problem is prevalent with around 1 in every 10 patients being hurt while receiving care. Challenges of antimicrobial resistance. The antimicrobial resistance is a major public health concern fueled by antibiotic overuse throughout the care continuum. An estimated 80% to 90% of all human antibiotic use occurs in the ambulatory context, with evidence suggesting that 30% to 52% of outpatient antibiotic prescriptions are unnecessary. Excessive antibiotic use is a leading cause of resistance and adverse effects. Excessive and inappropriate use of these drugs have prompted healthcare experts to express concerns about patient safety. These concerns have grown rapidly as a result of a lack of knowledge concerning adverse consequences such as antibiotic resistance, skin issues, hypersensitivity, and allergies. Notably, many teenagers and adolescents purchase and utilize over the counter medications without reading the directions. Evidence suggests that individuals frequently share drugs, utilize outdated products, double doses without consulting, store them poorly, and disregarded label expiry dates. And the challenges of medication complaints. Adherence to pharmaceutical therapy is critical, particularly when managing chronic diseases. However, approximately half of the patients do not take their drug as prescribed. So, these are the challenges faced by the Indian health system for implementing a proper pharmaceutical care process.